Hey everybody, Dr. T here. Today I'm going to talk about the health risks and costs of domestic violence. There's a huge disconnect between the prevalence of DV and what is done in the health system. The average cost of the medical care exceeds 8.3 billion per year as of 2024, of which the victim pays more than 1/4 of the cost. There are victim restitution fees that the abuser may be required to pay once they are charged for the abuse. In my case, I received an $83 check, not hardly enough to even assist me with moving out costs. The influence of abuse can persist long after the violence has stopped. Successfully addressing the complex issue of DV requires multiple prevention efforts that target specific risk and protective factors across individual, interpersonal, institutional, community, and societal levels. Survivors need a comprehensive response that addresses their safety concerns and may require advocacy around housing and shelter, legal assistance, and safety planning. The more severe the abuse, the greater its impact on the physical and mental health, and the impact over time appears to be cumulative. Traditional mental health systems often fail to provide culturally competent interventions that are developed from an understanding of trauma and its effects for restoring well-being and fostering empowerment. The data show that health insurance plans do not cover the entire cost of medical and mental health care visits. The fact that the victims must pay for part of their treatment adds insult to injury. If we had universal health care in the United States, victims would not have to pay twice with their finances and their suffering for a crime that they did not commit. Interventions that focus on more than symptom reduction, that are easier to access, and that avoid the stigma of mental health treatment may offer more acceptable approaches for reducing chronic suffering following trauma. In a one-day snapshot of these services, the National Network to End Domestic Violence reports that 66,581 victims are served in a single day, and more than 9,000 DV victims could not obtain the service they requested because the programs were over capacity. In 1985, the U.S. Surgeon General C. Everett Koop declared domestic violence the biggest health crisis of the decade. Progress has been made since then, but a lot more needs to be accomplished. If DV were an infectious disease, we would have a treatment center in every neighborhood.
If you or someone you know is in an abusive situation, call the National Helpline at 1-800-799-SAFE or text START to 88788. Everyone deserves a healthy relationship.